Mentioned a little bit about the signs that parents could look for, like nonverbal, or like after you reach a certain age and all of a sudden your child starts saying less and less. Could you talk about those signs?
So what should be happening now is when you're taking your children for your well baby visits, your doctors should be looking. There is a criteria that the doctors will look at, and they'll ask you, on top of the general milestones when you're going to your well baby visits, they'll be asking if they're doing this, they're doing this, they're doing this. So they'll be asking, how many words do they have? Have they lost any words? They look at their fine motor. They look at a lot of different things. Okay. When my son was diagnosed, I thought he was deaf. Or when I started to see things happening with my son, I thought he was deaf because he wasn't answering to his name. He was just kind of ignoring me. So I would say his name. He wouldn't turn around, and I was like, there's something wrong. So what we did was we reached out to our early intervention program. He was under 3, and we started getting testing done, and then we eventually came to the diagnosis of autism.
Could you talk a little bit about early intervention? As you said, you said your son was at the age of 3?
He was 18 months when he was diagnosed, yes.
Right. Could you talk a little about the importance of early intervention?
Early intervention and autism, not to cut you off, but early intervention and autism is the best treatment that you can get for your family member or your child affected, or maybe affected, whether or not it's autism or not. If you find something going on that is just not right, early intervention is the most powerful tool that you can use. So we know with early diagnosis and early intervention that we can make great gains, and children can lead productive lives. They can be completely mainstreamed into school. They can have outside curricular. Sorry.
No worries.
They can talk about. They can.
Got you.
Thanks. So they can do great things with early intervention. But early intervention can also start as an adult. Once you get out of high school, I call it early intervention for adults. Once they get into when they're living in SILAs and group homes and working in the environment. So we're going to have a tsunami of adults coming into the system, and they've already started. So a lot of organizations are building adult programming. So that what I call that is early intervention for adults. So the things that they missed maybe during their school academic years, and they didn't get that developmental piece, they're going to get that in the adult programs that are being put together for them.
Yeah, because you bring up a good point. A lot of people have grown up and not been diagnosed or misdiagnosed, and as we get more information now, I'm guessing that's having people look more into autism.
Right. Well, 1 in 50 study just came out. 1 in 50 school-age children are diagnosed with autism. So that's 1 in 31 boys, 1 in 143 girls. Now, if you look at those numbers, you're going to have a child in somewhere in the 6 degrees of separation is no longer there. You're going to know somebody that has autism. Right. They're going to be in your children's classes. They're going to be around your children. So it's not like we're not going to be able to see those. So 1 in 50 is a huge number. When my son was diagnosed, it was 1 in 500.
Wow.
And that was 10 years ago.